I'm Dr. Catherine Sims. I am a rheumatologist and I practice at Duke Health. I have a special interest in pregnancy and vasculitis. So at Duke, Maine, my patients are mostly pregnant patients with lupus or rheumatoid arthritis or psoriatic arthritis. But because of my special interest in vasculitis, I do see some patients that are not pregnant who have vasculitis. When I see a patient for the first time, I thoroughly review their chart before I meet them because it's important for me to understand what kind of workup they've already had, what kind of issues they've been suffering with, so that I can come in prepared to have the conversation with the patient. I typically have them change into a gown so that I can do a very thorough physical exam. We want to look at the skin and the nails and the hair. And sometimes little clues for the diseases can hide if we don't have them change into a gown. So that's part of a typical visit with me. We'll talk about what the next steps are. So this is what I'm suspicious of. These are the labs, maybe some imaging that we'll get in order for me to narrow down to the diagnosis that I think that you have. And then if they need other specialists involved or they need therapy, like physical therapy or occupational therapy, I can make referrals for that as well. One of the most gratifying things, especially my work in pregnancy, is that women have very specific goals in their life. And for some women, having a family is part of their personal goals. And sometimes women feel like they have to give up those goals because of their disease. And so our research and our aim is that women can achieve their personal goals in spite of having their vasculitis or whatever rheumatic disease that they have. And whenever women are able to get pregnant and have children, they feel more fulfilled, and we like being a part of that. And so that's a really, really nice feeling. Also in patients that aren't pregnant, just being able to make them more comfortable and more functional. So patients with rheumatoid arthritis, they have a lot of inflammation and pain in their hands. And for us to be able to treat them with medications and watch them really closely and watch them get better, and they can go back to work and they can, go play sports or spend time with their family. Those things are really important to many patients. And so to be able to restore their health and their comfort in order to live out the life they want to is very fulfilling as a physician.